What precautions should you take after you get vaccinated against COVID-19? Guidelines on that from the CDC are delayed. Today, Dr. Anthony Fauci said they will come out in the next few days. Dr. Fauci says we are at risk of another spike in cases. Experts are warning that we could see 60 to 70,000 new COVID cases per day. Despite this, states including Mississippi, Texas, and Alabama are quickly moving ahead with lifting their restrictions and ending their mask mandates. This weekend in Idaho, a group of parents brought their children to a demonstration. They burned surgical masks in protest of the restrictions. Joining us now is Dr. Lippy Roy, Medical Director of COVID Isolation and Quarantine Sites for Housing Works in New York City. Dr. Roy, good evening. Good to see you.
Always good to see you, Joshua.
Before we get to audience questions, could you just respond to this pushback that's driven partly by the dropping of restrictions and the expansion of the vaccine program? I understand why some folks are saying we've been locked up for a year, we finally got vaccines, a number of the infection rates are going down, death rates are going down, hospitalizations are going down. We're done. We got to get out of the house. This has to be the beginning of the end. Speak to those folks for a second before we get to audience questions.
So, Joshua, I really, truly empathize with the frustration, the anger that many people in this country are facing, and the world for that matter. I, too, want to go back to see Broadway shows. I want to go see sporting events. I want to see my Leafs hockey games. I want to do all of these things. I want to socialize with my friends and my family in person, and I want to do all those things. However, we're just not there yet. I am deeply optimistic that we're getting there. We're getting closer and closer, but we're simply not there yet. We have variants that are out there of the virus. Again, the virus is going to continue mutating as long as we continue to create an environment for it to grow and mutate. Yes, we have many excellent vaccines out there, but we haven't vaccinated the majority of the country. We're simply not there yet. I ask people to be patient. We're going to get there.
Let's get to some of your questions. In the meantime, look in the lower right of your screen. You'll find a QR code. Just point your camera phone at it, and it will take you to planyourvaccine.com, where you can get information on getting vaccinated where you live. Let's dive into questions. Ellen asked, after having the COVID virus, I know one has antibodies for a certain period of time. Are those antibodies only protective for the strain of COVID virus which one had, or can they also protect for the other variants to some degree? I plan on getting the vaccine at the recommended time, 90 days after initial symptoms. Doctor?
Well, Ellen, first of all, I'm so glad that you're going to be getting the vaccine. By all means, get that vaccine, because that vaccine is actually your best chance of protecting yourself from the virus and the different variants that are out there. While people who've been infected can have some natural immunity from the infection, data so far has not shown any evidence for long-term immunity. Your best chance for protecting yourself is getting the vaccine.
Kathy in Las Vegas asked, I have many Christian family members that will not get a vaccine because they think they are made from dead babies. Is this true? Doctor, before you answer, just by way of context, this has to do with controversy from some Catholic churches and also the U.S. Conference of Catholic Bishops expressing concern that some of the cell lines that were used in J&J's research come from aborted fetuses, cell lines that I believe go back decades. Isn't that right, Doctor?
So, Joshua, exactly. So to answer Kathy's question directly, the answer is patently no. None of the COVID vaccines are made from dead babies, or more specifically from fetal tissue, or in other words, tissue from aborted fetuses. Now, I will clarify that the fetal cell lines have been used in the development phases and research phases, but those fetal cell lines are derived from cells back in the 1970s, 80s that have been regenerated so many times, over thousands of times, they are unrelated to the initial cell line. So no dead babies in any of these vaccines. I
would also point to the statement from the U.S. Conference of Catholic Bishops, which reads in part, quote, while we should continue to insist that pharmaceutical companies stop using abortion-derived cell lines, given the worldwide suffering that this pandemic is causing, we affirm again that being vaccinated can be an act of charity that serves the common good. unquote. That's a statement from the U.S. Conference of Catholic Bishops. We've got a viewer in Tyler, Texas. Gloria asks, I've had my first dose of the COVID-19 vaccine. What am I to expect from the second dose? Many people have had reactions from the second dose. Can you answer the reasoning for this? Should we stop wearing our mask as our governor has advised? Dr. Roy, there's a two-part question. Let's start with reactions from the second dose.
So again, first of all, congratulations, Gloria, on getting that first dose. By all means, get that second dose. I'll share my personal experience. After I got the first dose, I got Moderna. I felt fatigue and pain at the injection site. Both of those side effects are extremely common. After I got the second dose, I again got some of the most common side effects, which were fatigue. I got body aches and chills. And those are the most common side effects. And again, it's not that you're getting sick, but it's rather your immune system is doing what it's supposed to do. It's revving up in preparation for the virus should it ever infect you. So it's doing what it's supposed to do. You're right. Some people get no side effects whatsoever. I'm jealous of those people. And others get mild side effects. The key is the side effects are mild and they're short acting. They only last 1 or 2 days.
And as for Governor Abbott's instructions dropping the mask mandate, should she continue to wear her masks?
We are not ready for any type of easing of these mitigation measures, Joshua. I recommend everyone continue to wear the mask, practice physical distancing until we get further data and guidance from the CDC, Joshua.
Again, that QR code in the lower right corner of your screen, just point your camera phone at it and it will take you to planyourvaccine.com with plenty of information for you based on what state you live in and also pre-existing health conditions on getting a vaccine where you live. Dr. Lippy Roy, good to see you. Thank you very much.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.